Thank you, and welcome everybody to the world of pragmatic psychology. My name is Susanna Mittermaier, and I'm supposed to be able to use this thing. Let me see. So the topic of this talk is pragmatic psychology. What abilities are hiding behind disabilities? And so this is a little introduction. My name is Susanna Mittermaier. My official titles are clinical psychologist and therapist and author and worldwide speaker. And my favorite title is being a happy person. I gave that one to myself. For me, it's an art to be happy. And pragmatic psychology is inviting people to an ease and a lightness of being that is not normal on our planet yet. Because a lot of things that people are suffering from is what doesn't work, what's wrong with them, and the dramatics rather than the pragmatics. So pragmatic means doing what works. So this is an invitation to what else is possible beyond the paradigm that we've been handed in this world, which is a lot about everything that's wrong about us rather than what's strong about us. So I started with just like I tried to be a normal psychologist, a normal therapist in Sweden, in Lund. I did therapy and neuropsychological testings as I was taught. And about 1 year into my job, I realized I would love to bring something else into this world, something that inspires people. Because what I saw was people coming to me and being sent from the psychiatry stuff, okay, this person has depression, this person has ADHD. So I met patients with very many different diagnoses. I worked with addiction, anxiety, depression, bipolar, whatnot. And so what I was handed was, okay, this person has this wrongness and fix it. And I'm sure you all know that situation where you sit there and go, okay, right, I'm going to fix a wrongness. And so I did what I was taught to do, and very soon into my work, I asked, hey, what else is possible here that I haven't considered? What different paradigm is possible to create for all of us? And so this approach, of course, started with a question. What else is possible? What do I know, and what can I change here? After all, it was time to change. And so I'm saying this because change always starts with a question. And a real question is when you not right away start to look for an answer. That's what we've all learned in our world. Look for the answer, look for the right answer. But real questions are where you take away your blindfolds and open up to a greater world and say, okay, what have I not seen yet? What other possibilities are there of how can I work? What do I bring into this work field that I haven't even considered yet because I try to do like everybody else? So maybe this is a question for you to ask. What are you personally, uniquely bringing into your work field that you haven't even considered? Because most of us try to do the right thing and we try to do the way we've been taught. But if you ask a question, maybe you find out what else you know that this world actually requires. So I'm so proud because this looks so professional. Just a side note. So for me was a personal a paradigm shift, a pragmatic paradigm shift to find out, okay, this is what I've been doing so far. What else is possible? And I started to go and let go of everything I've learned. And I know this is not what we're supposed to do as professionals and as academic people, but I actually let myself let go of everything I learned in terms of concepts and theories. And I ask, okay, so if I meet a person who has depression, anxiety, bipolar, whatever, I would really like to know what is going on for that person. And if I make my mind totally blank, which is a very hard thing to do for someone who is used to filling their mind with a lot of information. So what I did is I started to sit in front of my patients, or I prefer saying clients, and I I started to ask them questions. Okay, so that thing you call anxiety, what is it? What is it truly? And so this is where the journey started, of, first of all, everything I've learned, I let go. I let go of the point of view that I know more than the patient, which was a bit of a challenge, because if you have studied for many, many years, and you have all these wonderful concepts of what is that, and what is this, and what is that, then just letting go and really, really listening to the person's world that sits in front of you. And you have a moment where like, oh, I don't have any answers right now. But what if I don't need to have an answer right now? What if I can listen and get so much information of what you're telling me that I couldn't hear before because I was busy presenting an answer to you? So this is an approach I started to play with. And so I let go of the paradigm, which the doctor usually came with me for, that there's something wrong with the person. So I let go of the preconception that there's something wrong, and that the person has to live with what they have going on. And any conclusions I let go of. This symptoms means this. This diagnosis means that. And it continued with question everything. The patient knows. Patients know so much about themselves and from their experience and what their life is. They have so much knowledge. And the trick for me was to bring out that knowledge that already sits in them, and so they can actually start to find a pragmatic way beyond their own problems, rather than me trying to hand them what I have learned is right and true as far as change is concerned. So what I discovered is everything is the opposite of what it appears to be. Every problem started to be twisted into a possibility to find a way of changing people's lives. So the questions I started with, what I really can recommend is, person says, I have anxiety, I have a depression, I have whatever diagnosis, and I ask, okay, let go of everything. And that's a challenge, because you have to be willing to sit there and not know anything, like not cognitively know anything. And I ask, so, okay, anxiety, depression, hey, what is that? What is that thing you're calling anxiety and depression? Because if someone comes to you and says, I have or I am, there's a certain part of identification that there's not more room for asking questions. So what I did then is just, okay, so let's look at that. Let's see, okay, where is it? When does it occur? That thing you call anxiety, what is it actually? And what do we do with this? And then can we change it? And if it's a yes, you can ask, if yes, how can we change it? And sometimes there's a no. And I think most of us are not acknowledging when change is a no. Because there's some moments where the patient just doesn't want to change it. They say they want to change it, but they're actually not willing to change it. Then it's a really hard work to do some therapeutic something. And usually what I had going on, I felt like a failure, because I felt, I wanted to change the person's life. I wanted to show them something greater. And if there's a no in their world for change, it's like, oh, okay, I did something wrong. And so changing that and going to truth, can we change this? And that's a momentary thing. This might change the day after, but being in question of, is there a window of possibility here that's open, makes you have a totally different way of working with the client, rather than just assuming my job is to change you, right? And that's where you try to push change in someone else's direction, rather than asking, truth, does this person require change? Or, hey, what would you like to change? What part of that would you like to change, and what not? And then one big piece for me was to have total allowance. Total allowance of whether the person would like to change something or whether they not like to change something. Change is not always right. Change is just a possibility and a choice we all have. But it's not something we have to force ourselves to. So I ask, and then I trained myself of course, I wanted to have so much change for the person, as we all do. Like, how many times do you want more for your people in your life and your patients than they want for themselves? And having allowance for them only wanting to change that part when you know that is possible. You know, that takes a big piece of allowance, of allowing the patient to change the part that they desire to change, and allowing them to not change the parts that they would change. Because who are we to tell them that they have to change more than they desire? Oh yeah, I need to do this thing here. Yeah. So questions empower, that answers disempower. So questions are always something that opens the door to new perspectives. And so the biggest tool that I love using are the questions. So questions empower also. So questions do a thing that's very cool. Like when you ask someone a question, or when you ask yourself a question, you include yourself and you include the other person. It's not like you against the patient, or you like trying to get the patient to change something, but you actually ask them, and with that question, you invite them to bring to the table what they would like to bring to the table, right? So an answer confirms the rightness of the limitation. A question allows you to see what it is rather than what you have decided should be. So pragmatic psychology is empowering the client to create their own pragmatic way beyond the problem, and it's about focusing on new possibilities. And so I love the name pragmatic. Like when I was looking at what I would like to do here, it's like I would like to do what works, you know. And so this is where the name came. Okay, so results, quickly. What I found is that, so when I ask, what is it? You say you have ADHD, or the patient says you have ADHD. So, hey, what is it? What's going on here? And so those questions led to a big amount of awareness of what is what. And so ADHD, for example, I discovered it's a liveliness. There is so much, you could call me ADHD if you want. I actually did a test, and my colleague said, oh yeah, you totally classify for ADHD. But so I could suffer it, or I could ask, so hey, what's the capacity behind it? What's the ability behind that disability? And it's a huge amount of liveliness. It's a lot of energy that you can use. But if you have to focus it on one thing, it drives you crazy. Yeah. So some of you who might be a little ADHD tendency, if you try to do one thing at a time, not working. And so what helps, and what I discovered with working with ADHD, for example, is doing many things at the same time stimulates the brain enough to get things done. And I tried that with adolescents, with doing homework, and to have many things going on, many stimuli, which is great for the brain to be relaxed and to be able to actually have fun enough to finish things, which is exactly the opposite of what we've learned, what we should do with ADHD patients. And then we have depression and anxiety. They're usually a very extreme awareness. Those patients pick up a vast amount of information from everywhere. You could call it hypersensitive. You could call it awareness. You can call it whatever you want, but it's basically this extreme amount of, I just have so much, I know what's going on in the world, like you have this awareness of how other people are feeling, how their worlds are being, you pick up so much of what's going on in the world, and most of them have no idea how to deal with this amount of awareness. And then there's this hypersensitivity where people feel overwhelmed with their level of awareness. And so it's about teaching them the tools and giving them information about how to deal with this. Because what I've seen is many of them also go into addiction of some way. Of course, you know, coping strategy. What do I do with this vast amount of awareness? I medicate myself so it's not too much. Not weird. Just, you know, you do what you do. Anger management. Usually that's a lot of energy that people have, a vast amount of potency that's been misapplied and misidentified as something wrong, which is, oh, you're just an angry little girl. Or boy. So PTSD, or abuse of different kinds, is also, it's a potency of the willingness of changing your life, of not going down the cycle of abuse and trauma that we think is the only choice they have. So it's getting out of that victimizing story, and there's a vast amount of potency there. And autism, I worked a lot with autism and Asperger as well, and I do still. And what we see in the diagnosis book, it says it's antisocial, they're not communicating. They are communicating a lot, but it's for us to find out, to really acknowledge their different way of communicating. And if we really listen, they're very talkative, but they don't talk verbally, they don't talk with words, but they do talk a lot. There's a beautiful movie, by the way, I just know the German title, I'm sorry. But it's about an Asperger person, and you really see their worlds of how they function with their world, how much information they pick up, and how often they don't know what to do with it. Yeah. Da-da-da. And so, so the conclusion, really, really fast. It's so hard to do this in a short amount of time. So what if every problem or diagnose is actually a possibility? If a possibility and a strongness rather than a limitation and a wrongness. And I have to move this thing, right? And so my thing is, what if having problems is no longer the paradigm we have to live by? What if it's actually looking for what works? And there was a person before who presented about religion and showing a graph on Google Ngram on when psychiatry, psychology, and mental illness, those concepts started to boom, and it was 1920, 1940. Before that, we didn't have those. So this is concepts of modernity, like the modern world. And what if we actually are here to change, to create something different and really do what works? And what if we don't always have to look for what's wrong and have that focus, but hey, you think you're crazy, but hey, what is that crazy actually? Is there a diversity? Is there a nuance you bring to the world that no one has ever acknowledged? And so what if our past no longer determines our future? Whether it's our childhood or the past that's been 10 minutes ago when somebody says, oh, you're so stupid, and you're still holding on to that? What if you can just go, oh, well, what if it's not relevant, and move on? And what if you knew what works for you? And what if you knew what life you would like to create, despite all the conclusions of what's a right and a good life to create? What if you know what works for you? And hey, what if it's time to actually create a new paradigm where we, as people working in mental health, empower people what they know? And there's a lot more, but we don't have time for that.